everyone, my name is Kirby Alparaonda and together with my group mates, Miss Kahar, Miss Giamalon, and Mr. Lumugdang. And today we will going to have our discussion regarding our assigned topic.
So our topic was all about drug used to treat gastroesophageal reflux and also the peptic ulcer disease. So by the way, what are those diseases? So gastroesophageal reflux disease or GERD occurs when stomach acid enters the esophagus, while peptic ulcer disease are open sores that can form in the lining of the stomach or the first part of the small intestine. And also both GERD and ulcers can cause similar symptoms like burning upper abdominal pain and also the nausea. So in physiology of the stomach, there are three primary functions. So the first one is the storage of food until it can be used in the lower GI tract. And also second one is the mixing of food with gastric secretion until it is partially digested. And the number three is slow emptying of the stomach at a rate that allows proper digestion and also absorption of nutrients that the medicine from the small intestine. So in the secretory cells, there are three types. So the first one is the chief cells, the parietal cells, and the mucus cells. So what is the chief cells? Chief cells are the other type of exocrine secretory cells in the stomach. They secrete digestive enzymes that cleave the proteins in the meals into smaller pieces. We have here the parietal cells. Parietal cells are stimulated by acetylcholine from the cholinergic nerve fibers, gastrin, and histamine to secrete hydrochloric acid. You know what? The parietal cells are responsible for gastric acid secretion, which aids in the digestion of food, absorption of minerals, and control of harmful bacteria. So you can be safe because of this kind of cells. Also, we have the mucus cell. It secretes a mucus that coats the stomach wall. So the function of this kind of cell is to create a protective mucus layer. So through this type of cell, it protects the stomach wall, or yes, the stomach wall, to any kind of bacteria that can cause harm to our health or to our stomach or organs. So we have the common stomach disorders: gastroesophageal reflux disease or GERD, known as heartburn, acid indigestion, or sour stomach. It is the reflux of gastric secretion, primary pepsin, and hydrochloric acid up into the esophagus. Most cases of GERD pass quickly with only mild discomfort, but frequent or prolonged bouts of acid reflux cause inflammation, tissue corrosion, and ulceration in the lower esophagus. Any person who has recurrent or continuous symptoms of reflux, especially if the symptoms interfere with activities, you should be referred to a physician. And peptic ulcer disease or PUD is actually a several stomach disorders that result from an imbalance between acidic stomach contents and the body's normal defense barrier, causing ulcerations in the GI tract. The most common illnesses are gastric and duodenal ulcers. These are the several risk factors. This appears to be genetic predisposition to PUD. Some families have a much greater history of PUD than others. It is commonly held belief that stress causes ulcers, but no well-controlled studies to support this. Cigarette smoking increases acid secretion, alters blood flow in the stomach wall, and retards prostaglandin synthesis needed for defense mechanism. Non-steroidal anti-inflammatory drugs have twofold effects. They inhibit prostaglandins that protect the mucosa and directly irritate the stomach wall. And these drugs also slow healing. It is commonly thought that certain foods like spicy foods and alcohol contribute to ulcer formation. It is true that certain foods increases acid secretion and that alcohol irritates the stomach lining, but the results from the studies have not corroborative induction of ulcer formation by food or alcohol. So next, we have the treatment of gastroesophageal reflux and peptic ulcer disease. So one is the most important treatment of this disease is change in lifestyle. In order for you not to have this kind of disease, you need to do more activities, to do exercise, eating healthy foods, and many more so that you can prevent this kind of disease. Okay, let's proceed to the action. Antacid neutralize gastric acid, thereby causing the gastric contents to be less acidic. Coating agent provide a protective covering over the ulcer crater. And the uses, antacids decreases hyperacidity associated with PUD or peptic ulcer disease and GERD or the gastroesophageal reflux disease, gastritis, and hiatal hernia. And coating agents provide protective barrier for the mucosal lining where hydrochloric acid may come in contact with inflamed eroded areas. They are used to treat existing ulcer craters on the gastric mucosa. In nursing process for agent use for stomach disorders, we have the assessment. So what we are going to assess? So first, we have the nutritional assessment. So it is to obtain the patient data about current height, weight, or any recurrent weight gain loss and identify the pattern of eating like the food habits or snacking habits, and if they have a guide like food pyramid rather, like that. Next, assess the esophagus and stomach. Ask the patient to describe any symptoms in their own words. And we need to assess the pain or discomfort. Ask the patient to describe the onset, duration, location, characteristic of pain or discomfort. Next is to assess the activity or exercise. Just ask the patient what type of work or activities did he perform or she perform. And in medical history, just question our patient what self-medication had been tried, what prescribed medication are being taken, just like that. Next, we have anxiety or stress level. Just ask the patient to describe his or her lifestyle. What does the patient think are the stressor and how often do they occur? And in smoking, just ask the patient how many packs of cigarette that they consume every day. We have another type of nursing process, the planning. Planning should be based on assessment data and intervention should be individualized to address the patient needs. Another nursing process is the implementation. So here is the first one is nutrition. So we need to implement the prescribed dietary changes, eat healthy, eat small, more frequent meals to support optimal energy requirements and healing. So avoid eating junk foods and other unhealthy foods. In pain and discomfort naman, keep a written record of onset, duration, location, precipitating factors for any pain experience. Next, the medication. Take prescribed medication at recommended times to promote optimal healing. See individual drug monographs for suggested scheduling. So we need to implement lifestyle changes to our patient, discuss the stress and its effects on the persons, and implement needed lifestyle changes that are feasible, like encourage a significant reduction or cessation of smoking. So stop smoking, like promoting health to our patient. In the fostering health maintenance naman, we need to discuss medication information on how it will benefit the course of treatment to produce an optimal response. So the patient is needed to be aware on what he is going to take or what he is going to take a medicine.
For the continuation of Kirby's Paraondas report, drug class antacid, brand name Mylanta strength, generic name Semeticon. Action: antacid lower the acidity of gaseous secretion by buffering the hydrochloric acid. Normally, potential hydrogen is 1 or 2 to a lower hydrogen ion concentration. Buffering hydrochloric acid to a potential hydrogen of 3 or 4 is highly desired because the proteolytic action of pepsin is reduced and the gastric juice loses its corrosive effect. They may also act by deforming actions, drug disperse, or prevent formation by mucus-surrounded gas pocket in the GI tract. For the uses, antacid product for one of the largest sale volumes of medication that may be purchased without prescription. So, over-the-counter drug siya. Antacid commonly used for treatment of heartburn, excessive eating and drinking, and POD. The most effective antacid available are combination of aluminum hydroxide, magnesium oxide of hydroxide, magnesium trisilicate, and calcium carbonate. So next, nursing process for antacid therapy. Pre-medical assessment. Number 1, check renal failure studies to ensure that renal function is normal. When renal failure is present, patients should not take large quantities of antacid containing magnesium. Magnesium ions cannot be excreted and may produce hypermagnesemia and toxicity. Number 2, check the pattern of bowel elimination for diarrhea or constipation. Number 3, record the pattern of gastric pain being experienced, report coffee ground emesis, bloody stools, or recurrent abdominal pain to the physician for prompt attention. Number 4, if the patient is pregnant or has edema, heart failure, hypertension, or salt restriction, ensure that a low sodium antacid has been prescribed. Number 5, schedule other prescribed medication 1 hour before, 2 hours after antacid are to be administered. Side effect to expect. Chalky taste. A chalky taste is a common problem with antacid, suggests a change in brands or flavors. Suggests using a liquid dosage form instead of tablets. Side effect to report. Diarrhea or constipation. Diarrhea or constipation is a common problem when antacids are being used in therapeutic dosage to treat ulcers. Alternating between calcium or aluminum-containing compounds and magnesium-containing compounds should help alleviate the problem. Drug interaction. Tetracycline, antibiotics, ciprofloxacin, ketoconazole, digoxin, digitoxin, iron compounds. The absorption of this medication is inhibited by antacid. This medication should be administered 1 hour before or 2 hours after the administration of antacid. Levodopa. Levodopa absorption is increased by antacids. When antacid therapy is added, toxicity may result in the Parkinsonian patient who is well controlled taking a certain dosage or levodopa. Drug class: histamine H2 receptor antagonist. Brand name Axid, generic name Nizatidine. For the action, the H2 antagonists act by blocking histamine receptors, resulting in a decrease in the volume of acid secreted. One of the primary mechanics of hydrochloric acid secretion is stimulation of H2 receptors on the parietal cells of stomach by histamine. Uses: the H2 antagonists cimetidine, ranitidine, nizatidine, famotidine are now being used to treat GERD, duodenal ulcers, and pathologic hypersecretory conditions such as Zollinger-Ellison syndromes, and for the prevention and treatment of stress ulcers in critically ill patients. So, the H antagonist is unapproved uses include prevention of spinal pneumatic acute upper GI bleeding and hyperthyroidism. For the famotidine, it is similar in action and use to cimetidine but has the apparent advantage of 1 dose daily, fewer drug interaction, and no antiandronergic effect which cause gynecomastia. Ranitidine is similar in action and uses of cimetidine but has approved advantage of twice daily dosing, fewer drug interaction, and no antiandronergic effect. For niazidine, in contrast to the other agent, is not available in a parental dosage form. For the nursing process for H2 antagonists, pre-medical assessment, perform a baseline assessment of the patient's mental status for comparison with absence mental status evaluation to detect central nervous system alternation that may occur, particularly with cimetidine therapy. Side effect to expect: dizziness, headaches, diarrhea, constipation, and somnolence. Approximately 1% to 3% of patients develop this side effect. They are usually mild and resolve with continued therapy. Encourage the patient not to discontinue therapy with first consulting the physician. Provide for patient safety during episodes of dizziness. If patient
So the implementation, dosage and administration. For adult, by mouth 100 to 200 microgram tablets 4 times daily with food during NSAID therapy. Evaluation. Side effects to expect are diarrhea, and the side of effects to report is pregnancy. Although pregnancy is obviously not a side effect of misoprostol therapy, it is crucial that misoprostol therapy be discontinued if the patient is pregnant. The patient must receive care from the physician who prescribed the misoprostol and an obstetrician. The question of alternative therapies to NSAIDs must also be considered. Drug interaction is no significant drug interaction have been reported. Next is the drug class, gastric acid pump inhibitors. So the brand name is omeprazole and the generic name is Prilosec. The action of this is actions. Omeprazole is the first of a class of drugs that inhibit gastric secretion by inhibiting the gastric acid pump of the parietal cells of the stomach. Uses of this is used to treat severe esophagitis, GERD, gastric and duodenal ulcers, and hypersecretion disorders such as Zollinger-Ellison syndrome. Next is the therapeutic outcomes of this. The primary therapeutic outcomes expected from omeprazole therapy are relief of discomfort, reduced frequency of heartburn, and healing of irritated tissues. So the next nursing process is for omeprazole therapy. For medication assessment is check pattern of bowel elimination. Omeprazole may induce diarrhea. And the planning of this is availability by mouth 10 and 20 milligram sustained release capsules. Implementation, dosage and administration by mouth initially 20 milligram once daily. Dosage up to 120 milligram daily and divided doses may be required for certain hypersecretory conditions. Administer before a meal. The capsule should be swallowed whole. Instruct the patient not to open, chew, or crush. Evaluation. Side effects to expect are diarrhea, headache, muscle pain, fatigue. These symptoms are relatively mild and rarely result in the discontinuation of therapy. Encourage the patient to not discontinue therapy without first consulting the physician. Maintain the patient's states of hydration. Encourage the inclusion of sufficient roughage, fresh fruits, vegetables, whole grain products in the diet. Side effects to report is rash. Persistent vesicular rash may be cause for discontinuation of therapy. Report for further observation and possible laboratory tests. And the drug interaction is diazepam, triazolam. Omeprazole significantly increase the half-life of diazepam and triazolam by inhibiting its metabolism. Observation for increased sedative effects from these medicines. Caution against hazardous tasks such as driving and operating machinery. The dosage of diazepam and triazolam may have to be reduced. Phenytoin. Omeprazole slows the metabolism of phenytoin, observed for nystagmus, sedation, and lethargy. The dose of phenytoin may have to be reduced. And warfarin. Omeprazole may reduce the rate of metabolism of warfarin. Monitor the patient closely for signs of bleeding tendencies and monitor the prolonging time closely. Reduction of warfarin dosage may be required. So next, the sucralfate. Sucralfate inhibits the absorption of omeprazole. Administer the omeprazole at least 30 minutes before sucralfate. So next drug is the lansoprazole, which is the brand name of it. And the generic name of it is Pervacid. And the action of this is that the lansoprazole inhibits gastric secretion by inhibiting the gastric acid pump of the parietal cells of the stomach. Lansoprazole has no anticholinergic or H2 receptors antagonist reactions. It is chemically related to omeprazole. And the uses is that to treat severe esophagitis, GERD, gastric and duodenal ulcers, and hypersecretory disorder such as Zollinger-Ellison syndrome. And the therapeutic outcomes that the primary therapeutic outcomes expected from lansoprazole therapy are relief of discomfort, reduced frequency of heartburn, and healing of irritated tissues. So next, the nursing process of lansoprazole therapy. So pre-medication assessment is check pattern of bowel elimination that lansoprazole may induce diarrhea. Planning availability is by mouth 15 and 30 milligram sustained release and enteric-coated capsules. Implementation, dosage and administration by mouth initially 15 to 30 milligram once daily, dosage up to 180 milligram daily, and divided doses may be required for certain hypersecretory conditions. Larger doses may be divided into a twice daily administration, administered before a meal. If the patient has trouble swallowing the capsule, it may be pulled apart and the contents mixed in 1 tablespoon of applesauce. The evaluation of this is side effects to expect and report are diarrhea, headache, fatigue. The drug interactions are theophylline, sucralfate, altered absorption. So the
Drug class antispasmodic agents action. Drug or antispasmodic agents are actually anticholinergic agents. The GI tract is heavily innervated by the cholinergic branch of autonomic nervous system. Cholinergic fibers stimulate the GI tract causing secretion of saliva, hydrochloric acid, pepsin, bile, and other enzymatic fluids necessary for digestion, relaxation, or sphincter muscles, and peristalsis to move the contents of stomach and bowel through the GI tract. The antispasmodic act by preventing acetylcholine from attaching to the cholinergic receptor in the GI tract. The extent of reduction of cholinergic activity depends on the amount of anticholinergic drug blocking the receptors. So, because of the cholinergic fever, innervate the entire body, and these agents are not selective in their action to the GI tract, the effect of blocking the system are seen throughout the body. Uses. Antispasmodic agents are used to treat irritable bowel syndromes, biliary-spasms, mild ulcerative colitis, diverticulitis, pancreatitis, infant colic, and in conjunction with diet and antacids PUD. Planning. Glaucoma. All patients should be screened for the presence of close-angle glaucoma before the initiation of therapy. While a patient with the open-angle glaucoma can safely use anticholinergic agent, intraocular pressure should be monitored regularly. So, implementation, dosage and administration. Administer with food or milk to minimize gastric irritation.
So implementation, dosage and administration. Administer with food or milk to minimize gastric inhibition. Evaluation, side effects to expect. Blurred vision, constipation, urinary retention, dryness of mouth, nose, and throat. So, these symptoms are the anticholinergic effects produced by antispasmodic agents. So, patient taking this medication should be monitored for the development of these side effects. Side effect to report: confusion, depression, nightmares, and hallucinations. So, provide for patients safety during this episode. Reduction in the daily dosage may control the adverse effects. So, drug interaction: amantadine, tricyclic antidepressants, penotazines. So, this agent may potentiate the anticholinergic side effect, development of confusion and hallucination characters, excessive anticholinergic activity.